Hi, so my name's Meinou Simmons. I'm a consultant child and adolescent psychiatrist. I work with children and young people with mental health problems. So my background is I trained to be a doctor at Cambridge University many moons ago, and then I decided that I really wanted to specialise in psychiatry, mental health. And during my basic psychiatry training, I did a placement on a young people's adolescent, so teenagers unit with severe mental health problems, so really severe kind of self-harming, suicidal ideation, and bipolar disorder and things like that. And I really enjoyed working with children and young people, so I decided to subspecialise in that area because I thought actually in children and young people there seems to be much more of a chance to effect change, and I enjoyed working with different agencies like with schools and social care services, and it was quite satisfying to see that if we worked together to support a young person we could actually change the course of their lives and really help them to move forwards. So then I did my subspecialisation in children and young people's mental health, and gradually worked through training. And along the way, I also really developed quite a passion for education, medical education, so teaching and training medical students and junior doctors, and really spreading the word about how exciting working in mental health services is. As a trainee, I did a master's in medical education, and I've really retained an interest in teaching and training, which has accumulated in the last almost 2 years of being appointed as training programme director for Thames Valley, for people who are wanting to become consultant child and adolescent psychiatrists like myself. Because I have this real interest in education and training, when I was on my last maternity leave in 2019, I thought to keep my work side ticking over, I thought I'll write a handbook for parents and caregivers about mental health, because I realise there's a lot of confusion and kind of mixed messages and difficulty in finding reliable resources around on mental health. So I first thought I'll write quite a short book which will help to give parents and caregivers an introduction to this area, and then it actually turned into a longer project than I first imagined, as my son is turning 4 in April now, so it's taken me a few years to get to this point. But I'm really pleased that I have developed the book, and it's out there now for people hopefully to use as a reliable resource to kind of find some basic information about understanding mental health and supporting children, young people with difficulties.